obviously we are in a pandemic right now, and COVID has definitely changed how we manage healthcare. But fortunately, we do have excellent vaccines that have high rates of efficacy in the general population. But we also know that patients with hematologic malignancies don't respond as well to the vaccines. And in particular, myeloproliferative neoplasms, or MPNs, are a rare and heterogeneous group of hematologic malignancy patients that are known to have immune dysregulation and unclear responses to vaccines. And so the purpose of the study that we did was to really understand the immune responses that MPN patients specifically have after receiving the Pfizer and Moderna vaccines against SARS-CoV-2. Yeah, so we were interested in looking at serologic responses after 1 month after completing the vaccine, which is sort of a traditional measurement of immunologic responses against vaccines. But we're also interested in looking at T-cell responses because there's been a lot of data indicating that T-cell responses are an important aspect of protection after vaccination. And so we looked at total IgG, IgM antibody against the SARS-CoV-2 spike protein using a qualitative ELISA 1 month after finishing the vaccine. And we also looked at T-cell responses using interferon gamma release assays. We used 2 different assays. One is an ELISpot assay, where you actually look at the number of activated SARS-CoV-2 specific T cells that you count in these different wells. And then we also looked at interferon gamma release in the plasma using a whole blood assay. And we looked at these responses in 28 MPN patients 1 month after they received both doses of either the Pfizer or the Moderna vaccine series. And we also had a group of healthy controls. I think we had 26 healthy controls. And so we compared the serologic responses and then the T-cell responses in these 2 groups using these assays. Found that MPN patients did have very good responses. So in terms of the serologic responses, we had a 96% seroconverting rate, which was the same actually as what we saw in the healthy control group. And we also saw in the T-cell responses on the ELISpot assay, we found that MPN patients also had high response rates. It was 93% T-cell response rate on this assay, compared to 100% within the healthy donors. But even though MPN patients demonstrated very good responses, we detected that there's likely at least some subtle deficiencies in cellular immunity that are present. And so when you actually look at the magnitude of the T-cell responses on the ELISpot assay, we did see that MPN patients had lower magnitude responses compared to the healthy donors, although it's a little bit unclear if a lower magnitude response, even with a good threshold response, would correspond to any differences in how well protected you are after the vaccine. And we also noticed that there was a discordance between the T-cell responses in the whole blood assay and the ELISpot assay. So whereas the healthy controls, 100% of all participants had a T-cell response on both assays, within the MPN patients, only 54% of the patients had a response on the whole blood assay, despite having 93% response rates on the ELISpot assay. So this likely indicates some subtle deficiencies in cellular immunity that the ELISpot assay is not picking up, and that's something that we'll have to investigate further. These results give us a lot of information about, one, how MPN patients respond to vaccines, and that gives us insight and sort of, recommendations for boosters or how patients should behave sort of after they receive their vaccine. I think that a lot of the results are encouraging because we did see high response rates serologically and in the ELISpot assay. But I also do think that MPN patients do have an element of immunocompromised, and our results were sort of most salient in the myelofibrosis patients, and they might be driving down a lot of the response rates that we've seen. And so I think that our data supports sort of recommendations for getting booster vaccines, which is generally recommended in all cancer patients in official guidelines. And I think that even after receiving the vaccine, we don't know yet what the effectiveness is in this population. So certainly patients should still exercise, all the guidelines, wearing masks and washing hands and sort of avoiding sick contacts, et cetera. And so I think also, trying to investigate some of these differences in cellular immunity that we might see after vaccination might also give insight in sort of how MPN patients have abnormal immune systems in general, and maybe how immunotherapies might have some application in these patients to actually treat their diseases. So certainly a lot more will need to be studied to sort of understand the immune systems of these patients. So thank you so much for the opportunity to talk to you about the study that we did. And certainly, we are continuing to study this cohort. We're looking at longer term responses after the vaccine and looking at responses after the booster, and also trying to use different immune profiling techniques to sort of better understand why we're seeing lower magnitude responses or discrepancies between assays in sort of this initial study.